All right, so welcome Dr. Singh to our HIV expert Q&A. Thanks for taking the time out of your busy day, to talk with us and share your thoughts about the topic of HIV, especially for those people who may not be fully aware on what HIV is. Like I said, my name is Brandon. I'm a third-year pre-medical student in Dr. Brown's HIV aging research lab here at UCR. And unfortunately, Iman could not be with us here today, but hopefully we'll still get some good information out of this interview. And let's move
Happy
on.
to be here.
Yeah, and so yeah, Dr. Singh, would you like to introduce yourself and kind of tell everyone who you are and what you kind of do?
All right. I'm Dr. Tulika Singh. I am infectious disease trained specialist. Also do HIV and internal medicine, primary care. I work at Desert Days Project in Palm Springs, California since 2017. And my passion is taking care of HIV primary care patients as well as rapid start for HIV treatment and PrEP.
Nice. And I actually saw in your bio that you went to medical school in India and then you came over here to do your residency. Is that true?
Yeah, I did my medical school in Manipal, India, and came here to do my master's in healthcare administration and then residency in internal medicine, chief residency in infectious disease fellowship. And then, yeah, now I'm an attending here. I'm also a clinical assistant professor with UC Riverside and teach family medicine residents. Infectious disease, have given lectures for their noon conferences. Also director of research at Desert Days Project, and excited to do HIV aging related research with Brandon Brown from UC Riverside and other researcher collaborators.
Oh, nice. Okay, great. Yeah, so you're all over the place. I didn't even know you were one of the clinical teachers here at the UC Riverside School of Medicine. That's great. And so let's move on into the question. So many of us in the research lab are familiar with HIV. We've learned in some of our biology classes how it kind of takes over our body's DNA mechanism and kind of makes copies of itself. And obviously, you're extremely well versed on that. But there are a lot of people out there that may be watching this who aren't exactly sure what HIV is and how it affects their body. How would you kind of describe HIV to the average person?
Yeah, so HIV is a virus. It's a chronic virus. When it enters the body, it takes over the immune system because of entry into the CD4 or T cell. These in the immune cells, and it basically integrates itself in the DNA of the human immune cell and in basically makes it completely functionless, and the T cell counts go down as the HIV replicates or reproduces in our body, in our system, and leads to reduction in T cell counts. And when they go less than 200, that's by definition AIDS definition. So there's HIV disease initially, and then progresses to AIDS if the patient is undiagnosed and untreated. So not only just the immune system, because of lowering the immune system, it leads the body as being prone to opportunistic infections like pneumonia, a special kind of pneumonia called pneumocystis pneumonia, other infections, thrush in the mouth, toxoplasma, CMV. There's different viruses and bacteria that can attack the human body once our defenses are low because of the lower T cell count or CD4 cell count.
Okay, so yeah, so in case that was unclear to people, so it basically weakens. What does it weaken our immune system? Our body's basically attacking itself.
So not necessarily bodies attacking itself. That would be a more of an autoimmune process. This is more because the immune defense cells are going down in number. They're not able to help the body fight the external infections of different bacteria and viruses. For example, if I don't have HIV and I get a cold, I just get a cold. But if someone has HIV and have lowered immune system because of the lower T cell count because of HIV, that can develop into pneumonia, which is a lung infection, a more severe form of a cold.
Okay. Okay, cool. Thank you for that. And so who can get HIV and like who's most susceptible to HIV?
So anyone is susceptible. So HIV is a sexual virus, so it transmits through sexual activity and protected sex, but it is also in the body, in the our fluids. So it can be transmitted via IV drug use if we share needles. It can be transmitted. It can be transmitted vertical transmission from mom to a child. If mom has detectable HIV viral load infection in her system, can give it to baby during birth or during the process. And it can also be, you know, right now we do check the blood donation for all sorts of viruses, especially HIV, but it was transfused before from one infected blood to another, and could blood transfusions previous to 1987 also caused HIV. A very famous case, Brian White, who was a young hemophilic child boy, adolescent boy who got blood transfusion for the treatment of his hemophilia, got HIV from an infected blood and ended up dying of the complication of AIDS. Led to the, you know, donation screening, blood donation screening process, and it changed basically the whole donation world because of his death brought to the light that, you know, the blood needed to be checked for these viruses.
Okay, cool.
A
And
little
then
history
so,
there.
what was that? Sorry.
There's a little history there of Brian White.
Nice, thank you for that. Yeah, I think especially like that last bit you said, I don't think a lot of people know that. So definitely thank you for sharing that. And so yeah, as you can see, a lot of people, or basically everyone, right, is susceptible to HIV. But I remember back in the day, it used to be called GRID, right? The gay
Yeah.
related immune disorder. I think that's what it stands for,
Yeah.
right? And so what
Yes.
causes?
Okay, yeah. So I've skipped on that part, but definitely MSM, we call the terminology, which is men who have sex with men, are at the highest risk of getting HIV because of, you know, lack of condom use and also endemicity in the population. So the more house patients that are there, they are able to transmit it more in the gay male community, and that can be prevented with the use of condoms plus PrEP, which is pre-exposure prophylaxis with Descovy or Truvada, which is medication to not only treat HIV with the help of another drug, so it's not a complete treatment on its own, but for prevention, it's a complete treatment. It's one pill, combination of two pills inside it, and that can be prevented. But MSM, gay men are at the highest risk of getting HIV because of endemicity as well as sometimes lack of condom use. Yeah.
Okay, got it. Cool, thank you. Yeah, and I think that's been a common stigma, especially among kind of like HIV. A lot of people think mostly only people that who are homosexual, like gay men, are people that can get it. But like you said, definitely can apply to everyone there.
Mm-hmm.
And so I think another thing people commonly, another common misconception is that people kind of use the terms HIV and AIDS synonymously.
Mm-hmm.
And so what's the difference between those, would you say?
Good question. So HIV is the initial disease. So when you first get the HIV virus in your system, you have HIV disease. And if that's undiagnosed and it progresses and your immune system is going down, your T cells are going down, it reaches to a point where T cell counts are less than 200, that by definition becomes AIDS at that point, which is AIDS immunodeficiency syndrome. So basically, it's like a very advanced stage of HIV disease. So our goal is always to diagnose patients initially as soon as possible. They get the infection and start treating them so they don't get to the AIDS stage. The other way AIDS can be defined is by having, even though you just got the infection initially and T cell counts are not that low, but if you get an opportunistic infection or cancer related with HIV, then also you can qualify for the AIDS definition. But usually the terminology is reflective of the T cell count drop to below 200. It's called AIDS.
Okay, so AIDS is kind of more a further along stage of HIV once you have very few of those CD4 cells.
Yes.
Okay, got it. Thank you. And then so another thing, how long can and like you said, it's transmitted through bodily fluids. Like semen, blood, like through sharing needles and that type of stuff. But how long can HIV actually live outside the body?
Yeah, so, it can be on the surfaces around, I'm just ballpark, 24, 48 hours. But it is not in a high dose enough to be transmittable. And it also has to have kind of like a moist form to be able to transmit it. So if it's just, spilled on the floor or on the table and then dries up, chances of you getting an HIV from that exposure with an intact skin is quite low.
Okay, yeah, and you mentioned intact skin, so only if you have like a cut or something is maybe how you would be able to get it transmitted if you do touch something like that.
Yeah, so theoretically you can, but practically we don't see that again. It's probably deactivated at the point. It's depending on how much time has passed. But even if you have a cut and you touch something with the dried up blood of HIV, the chances that you're not gonna get that.
Okay, cool. And so I think so we talked about how deadly HIV can be once it progresses to that AIDS stage. How can people make sure that they're not spreading HIV? How can they so like when should people get tested for HIV just to make sure that they're not carriers?
I would say after any exposure that can transmit HIV, like any unprotected sex, there is no time really, but people on PrEP who are preventing themselves from getting HIV with the help of Descovy or Truvada pill, they get tested every 3 months at least to continue the PrEP therapy. That's the protocol. But anyone else who's not even on therapy, if they have had an expected, condomless sex, then they should get tested. So more frequent testing, if you have high risk behavior, then better.
Okay, nice. And then are like false negatives and false positives pretty common with HIV testing or not really?
So depending on the test, most of the tests are pretty sensitive and specific. So you can get an OraQuick, with just a swab test, or you can get a finger stick test, and they are pretty sensitive. So the false positive or false negative testing used to be more in the older test, but the newer tests are pretty sensitive. And, we just don't do it one time and test one time. We always do a confirmatory test too after a rapid test. So those, combined together, that is almost 100% sensitivity.
Okay, cool. And so let's say I had HIV. Would a better nutrition improve my condition and immune system if I did have HIV?
So yes, it will help because give your body, if you got good protein reserves, it'll give your body the strength to fight the infection. But also more than that, if you're smoking and you quit smoking, or if you drink alcohol and you quit drinking alcohol, that will help you more than just the nutrition. Those two habits, they really hurt the liver and the lungs, and so does HIV. So if you improve your overall healthy habits, that would help you fight the HIV better. Yes.
Okay, cool. Thank you. And in your opinion, what do you think is the most common misconception that you see about HIV?
The most common misconception I still see is that it's a life-ending, very macabre, end of life kind of diagnosis, and my life is over. Patients think like, oh, I got HIV, and then I explain to them like, actually not. We actually caught it really early. You can take this one pill once a day regularly on a daily basis, and we can get your viral load down to undetectable and maintain your T cell counts quite high, and you are actually gonna live as long as someone who didn't have HIV, if you maintain your health by taking your medication and other comorbidities like reducing smoking, and reducing alcohol. So it's still interesting to see that people, like you asked earlier that question, they think HIV disease is like AIDS, they're like dying, and they're very happy to hear, and then in 4 weeks they come back after being on the pill and their viral load has gone down to undetectable. They feel great, and they're like, "Wow, I thought I was gonna die from this, but here I am. I'm doing so much better."
Nice. Yeah, that's always great to hear. And then so that's actually a perfect transition into the next set of questions I have here. So on medication, and how quickly does HIV medication work? I know you mentioned like just a couple of weeks and stuff, you already saw improvement.
Yeah, so the medications now are so potent and they are so, effective and with very few side effects that the compliance of taking the medication daily has improved quite a bit. Before, there were medications that were multiple pills, multiple times a day, or sometimes injections too, and were not that potent, not that effective. It was hard to take. People would forget to take their next dose. But now the pills are one pill once a day mostly, and you have to remember to take it once a day. I tell my new patients to put an alarm on their phone. We'll just remind them just to get in the habit, and then they just can remember taking it. But I have seen improvement from almost over 100,000 copies of new HIV viral load detected in a newly diagnosed patient to being undetectable in as early as 4 weeks. So it's very nice to see that. Before, the older medication were not as potent. We could see the results of undetectable viral load in about 12 weeks to 16 weeks, even up to 24 weeks. But now we see it within four to 6 weeks, and which is, there's been a great improvement in the potency of the medications and the ease of taking it, plus least amount of side effects.
Yeah, that it's crazy how far like medicine has advanced, throughout time, and how these drugs are becoming more and more effective. How could or can people become HIV drug resistant, even to these new ones?
Yes. So if they're taking that one pill once a day, now remember, even if it's one pill once a day, it's a combination of 2 or 3 pills inside that one pill. So if you don't take that one pill once a day, you're missing basically 2 or 3 classes of medications. And so when you do that, the virus gets stronger because the level of the medication pharmacokinetically, the level of the medication required in the blood to suppress the virus goes down, and the virus is getting a little bit less dose of the medication that it needs to stay suppressed, and so it starts overgrowing on top of it, and that can lead to the virus becoming resistant to one or all of the parts of that one pill once a day regimen. And you can have a class effect too. What I mean by that is we have about 30 medication options. But if you get resistant to one medication, which has 2 or 3 different pills, you can also become resistant to some other options of pills which have those different, regimen parts in it. So the best way is if you have to, and no, I can't say that on camera, but take it daily. But if you have, for some reason, if you have to quit it, just quit it completely. Don't take it one day and then not take it other day, then take it one day. This is what makes the virus resistant and stronger, and not effective against the medication, because now you're giving it a little bit of dose and it gets used to it.
Right. Okay, cool. And so since we now know, right, that HIV can cause AIDS and thus a weaker immune system, I think this really applies, especially now into the current COVID-19 pandemic situation that we're in. And so for people with HIV, how would their risk for COVID-19 be affected, compared to other people without HIV?
Very good question. Traditionally we were noticing that pretty much every infection imparts the HIV patient into a higher risk, just because the immune system is compromised, and the different infections kind of co-infect with the HIV. I'm talking about hepatitis B and C. Those are actually worse when you have HIV as well, the co-infections. But we're not seeing that with COVID. With COVID, actually, for some reason, our patients are actually protected unless they have other comorbidities that are traditionally high risk for COVID, which is diabetes, lung disease, cancers, and low T cell counts. So severe AIDS disease with HIV, low T cell counts, that is definitely an independent risk factor for COVID. But other than that, if you have good T cell counts, your virus is suppressed, you're actually even almost, I can say, is almost like a lower risk for COVID. Of 100 people that we're seeing who got COVID, only 15% of them have HIV also. So, they are different speculations why that happens and why is that happening. But, it's a good news and we'll take it.
Yeah. Yeah. If it ain't broke, don't fix it, right? Let's say just don't question it. And so, another question I had is like, how similar are HIV and the SARS coronavirus 2 virus?
And I think it's more, well, both are viruses, but coronavirus is more of an acute virus, and HIV is a chronic virus. But I think the experience of patients are pretty similar, because initially when people started getting HIV, like you said, even the name wasn't, decided what we were going to call it. Right from the get-go, it's been the same thing. There's a lot of unknown between the two viruses. There's was no effective treatment for COVID. There's no effective treatment for HIV initially. People were dying of HIV. People are dying of COVID. And also it transmitted, and in the form of transmission was largely unknown initially for HIV. And when you were saying like it was considered a homosexual disease, and then later on they found out, okay, it's also in heterosexual, also vertical transmission, also from blood transfusion, also from needles. So there's a lot of speculation about COVID as well. It's like, is it airborne or is it not? Is it droplet? Is it just droplet? So there's definitely some similarities, and the unknown, and then the masking. If you see the old, some old documentaries on HIV patients when they were admitted in the hospitals, you'll see that they were wearing masks, and people would wear masks to visit them, not realizing or not knowing that there was no airborne transmission from HIV. But this is what some of the patients might be experiencing now when they're wearing a mask for COVID. Is like, oh wow, this reminds me of the initial AIDS HIV days when people were dying and wearing masks. So there are definitely some experiences, and psychologically, I think mental health wise, that brings a lot of our past patients into getting reminded of those days, and which kind of like a PTSD almost, is like, oh, here we go again. But the good news is, like I said, the coronavirus is not the SARS-CoV-2 is not attacking HIV any more preferentially than it's actually not attacking HIV patients that much, persons living with HIV that much. So that's the good part. But yeah, there are definitely similarities.
Okay, nice. And so I remember you mentioned kind of near the beginning of the Q&A about it can be transmitted from pregnant women through their to their children when they're born. And so let's say there's a pregnant woman living with HIV, do they have does their child have a higher chance of acquiring that COVID-19, or is it kind of similar to what you just said?
Yeah, it's kind of similar. I mean, the COVID is not anymore, prone to be in a pregnant woman or the unborn child than regular. But if she has, other risk factors, then she can get the COVID and transmit it to the baby. And there's been a vertical transmission of COVID in a baby. There's a case report, but largely we're not. Like if the mom doesn't get COVID, it's not going to transmit the COVID.
Okay, got it. And last question here. What precautions can people with HIV take to protect themselves?
From
This is just in general. This isn't really related to COVID, but it's like, let's say I had HIV, what could I do to kind of just protect myself, make sure I'm not spreading it to others?
Oh, okay. Yeah, U is equal to U. So if you're undetectable, you're untransmittable. The first step we can do, as if we are HIV, people living with HIV, is that suppress your virus, take your medications daily so that you don't transmit it to your partners and loved ones and your, and you can basically end the epidemic, because most of the HIV transmission is through person to person sexually. And so if you are undetectable, you cannot transmit the infection sexually. And that's what the U is equal to U mean. You have to do your best to stay suppressed and, not transmit the virus. And then the other thing you can do is get on PrEP. If you are high risk, or your partner is high risk because of you, then get them on PrEP. Prevent the HIV acquisition by using condoms, but also from PrEP by giving Truvada or Descovy. and, preventing your partners or loved ones from getting it. And if you have high-risk sexual behavior, which is basically unprotected sex even once, is high-risk sexual behavior in my, a mind. So if you have high-risk sexual behavior, just get on PrEP. So.
Okay, cool. All right. Thank you, Dr. Singh, for answering all of our questions here and just kind of educating our community, on those common misconceptions and just things that a lot of us probably didn't know before. So definitely thank you for that. Thank you for your time, definitely, and yeah, taking the time out of your busy workday to come and talk with us. But
No worries. Thank you. The sun was moving strangely and was hitting my
yeah,
eyes, so I had to move a few times. I'm sorry about that.
no worries. But yeah, thanks for being with us.
Thank you. Good to
Okay.
have you.